Welcome to another episode of Manta Cares Patient from Hell podcast club. My name is Mike Lynn, and I'm a patient advocate here at Manta, and I'm going to be your host today. Today's episode is funded by the Patient-Centered Outcomes Research Institute, or PCORI, and the goal of the collaboration is to bring doctors or researchers onto the Patient from Hell podcast club to share about their research so more of us can learn about it and use it to help us as patients or care partners. In turn, the podcast club then gives us the opportunity to chat with members of our community and to get their perspective on a certain episode. To put it more simply, this is kind of where theory gets put into practice, or cancer patients and their loved ones can see the clinical side of things and hopefully apply it as we update standards of care or knowledge about the practical world of cancer. So today, my guest is Brenda Elveen, a breast cancer survivor and a director of patient navigator services. And Brenda, I'm really excited to hear your story and thoughts on the podcast episode. But before we get to that, let's start with your personal background in the cancer and advocacy space, and then we'll move on to our thoughts about the discussion between Samira and Dr. Srinivasan. Brenda?
Thank you. Hi, my name is Brenda Elveen. I work at a nonprofit organization in Northern California where we provide services for breast and gynecologic cancer services. I myself am a breast cancer survivor. I was diagnosed about 15 years ago. I was 39 years old at the time. Had no idea what it was. I was very unfamiliar with the language and terminology that's used and very overwhelmed. My daughter was 5 years old at the time, so there was a lot of fear around that and panic. I've told some people that one of the first things that popped into my head was that I was going to have to start writing her cards for every occasion throughout her life, whether, it was high school graduation to marriage to all the things. It's just a state of panic for sure. I was something called triple positive, meaning I was estrogen receptor, progesterone positive, and HER2 new positive, which meant that I needed to do neoadjuvant chemotherapy. That's when you have chemotherapy in advance of any surgical procedure. So I did 6 rounds of chemotherapy with the HER2 or Herceptin medicine, and then went on to have a lumpectomy followed by continued chemotherapy every 3 weeks, radiation therapy. And at the end of a year of the Herceptin treatments, I was put on tamoxifen for 10 years. So a little... and it's funny because now I work at this organization where we provide support services for people with cancer. And one of the things I'm passionate about is educating people about their diagnosis and an attempt to help empower people to play an active role in their care. But interestingly, when I went through it, I was completely ignorant about everything. I had no idea what anything meant. Embarrassingly, even when I got a phone call for my first infusion, I asked the receptionist what a infusion was. I mean, it was just no clue what I was doing.
I mean, that's actually kind of a perfect segue into what we're going to be talking about today. So today we're reacting to an episode of The Patient from Hell, which has Dr. Anitha Srinivasan, who is a surgical oncologist who works at a safety net hospital in New York. And I recommend watching it if you haven't seen that. It's a relatively long episode relative to what this will be, but it's really in depth, and it covers a lot of how decision-making is made, both from a provider and a patient sense. And I think that, everything you listed there, the lack of knowledge per se about, new patients is almost pervasive because, I had the same experience as you. I was diagnosed with stage 3C metastatic melanoma when I was 30, and I was dating a medical professional. And on day one of doing immunotherapy, I had no idea what I was in for. It is an entirely different world. The terminology you start to hear at the beginning is overwhelming, and it feels like these decisions that you're being forced to make, is I put in air quotes because you don't know what the options are necessarily, but it's something that moves quickly. You're not given, really a map that's accurate, or at least I wasn't in my experience. And I believe that's many other patients' experience.
Yeah.
Relative to the episode, I want to talk about, Dr. Srinivasan works at a safety net hospital, which is a hospital that accepts all patients no matter what their insurance status is, their pre-existing condition status is, and that, they don't look into their finances, anything like that. They make sure that everyone receives care. And you brought up, you were starting a family, you were worried about, your future as it relates to your daughter in terms of an emotional sense, but also probably being able to take care of your daughter and, her long-term future. How did that feel? Because I don't have kids and I can't imagine what it's like to put someone through that. I put partners through it and friends, but man, the stress of having a small child when you're diagnosed must be enormous.
Yeah, that was really stressful. And what I didn't mention, which was also really upsetting and terrifying, is I didn't have health insurance at the time. So the episode that I just watched and hearing about the safety net hospital was really inspiring because I was panicked about what to do. And at that time, it was 2009, and I believe it was still what was it? If you had a pre-existing condition, you couldn't get insurance. So I had found a really large lump, which was more on the side of my breast. So I wasn't even thinking about breast cancer necessarily, but I kind of delayed following up on it because I was afraid that if it was something serious like breast cancer, since I didn't have health insurance, if I found out before getting health insurance, it would be considered a pre-existing condition and I wouldn't be eligible for health insurance, if that makes sense.
Yeah, absolutely.
So
I mean, funny anecdote. No, sorry, I keep cutting you off here, which is not my intention.
no,
But I'm self-employed and have been my entire life in whatever capacity. I owned a transportation company when I was diagnosed for the first time, and we were switching insurance providers. And I have spent 1 month in my adult life without insurance, and it was the month I was diagnosed. And so, yeah, very relatable.
yeah, that's funny because I'd had really great health insurance, for many years before, but I had stopped working at the time so that I could spend more time at home with my daughter, and I was on one of those health insurance plans where it's just a monthly fee that comes out of your credit card automatically, and my purse got stolen, so my credit card was canceled. And by the time I caught up with the fact that the automatic payments weren't being made to the health insurance company, they had dropped me.
Yeah, I mean, especially in 2009, these things weren't as easy to keep automated and to update if they weren't. I can completely relate to that.
Yeah, so that's, I think, where we were really panicking. And my husband at the time, he was working and had health insurance, but I wasn't on his. And for some reason, we didn't think I could get on his health insurance. But, after about a month, we figured something out, or I don't know how we had missed it, but I was able to get on, and it was retroactive, thank goodness. So, but when I had actually, just to back up a little bit, even I ended up going to see my gynecologist for the lump, and she felt it, and she met with me after hours because she was worried about the pre-existing condition as well, which I really appreciated. And then said, here's a place in Vacaville where they do pretty low cost mammograms. Let's get you in there. So I went there, and my daughter was with me, and they did the mammogram, and then right away we're like, oh, let's do an ultrasound, but we'll comp it for you. So they didn't even charge me for the ultrasound, which was kind of a disconcerting feeling when they're like, whatever. And then, the radiologist came in and put his hand on my shoulder and was like, it's going to be okay, but we're going to call your doctor. And so it was tough because I had my little girl with me too, and then trying to not react. So that's how my journey started.
Yeah, I mean, man, there's a lot of crossover between our journeys, very different cancers and very different times, but lack of insurance, and I was diagnosed by like I said, I was dating a medical professional at the time. I was diagnosed by her friend who was a dermatologist at said dermatologist's birthday party. In a room full of medical professionals, she just goes, "Oh shit, you have cancer." It's always weird to get the hand on the shoulder, as you were saying.
It is. It's like, here we go. And then, when your doctor calls you on the way home, you're like, why are you calling me?
Yeah. I when during that month where I didn't have insurance, I went to go get a consultation from one of the, best researchers at UCLA. And we were in there and I said, yeah, I'll just cash pay because I don't have insurance right now. And he said, look, man, I'll take care of it. And I was like, oh no, I'm in trouble. So
exactly. So true.
You are leading into these questions beautifully that I have. You were talking about the way in which your care was directed kind of by these symptoms and or the presentation of them linearly through how you were finding out. How was the experience once you got like a more real diagnosis? were your options laid out, relative to what the best treatment or the standard of treatment was at the time? Or did they just say, here, you have to go do this, and then you just kind of went through it?
Yeah, that's very much kind of what it was. It was, I just, and like so many of us, we just don't know the questions even to ask. So I was just basically like, whatever you tell me to do, I'm going to do. So I had no real understanding of, the difference between having neoadjuvant chemotherapy versus adjuvant, what HER2 positive meant, like nothing. I just saw the surgeon. She did the biopsy and then put my port in and then said, we're going to start you on a course of chemotherapy. And it just went from there. And that whole entire year, I asked very few questions. I do remember asking my medical oncologist if I should eat blueberries. And he was just like, don't worry about it. Just eat whatever you can. And so I ate popsicles and Pop-Tarts mostly. And that's about all I could get down.
You're here, so it needs to be working.
Yeah, it worked.
It's always interesting as I look retrospectively at my case and talk with other patients about theirs. And now, you're referencing what is essentially a 16-year-old case. The standard of care changes so often and for the better, almost entirely in these, really, really advanced metastatic cancers, or almost any cancer. And even my treatment, which started 7 years ago, the standard of care would have been different. I did neoadjuvant immunotherapy, but I did adjuvant immunotherapy, and it should have been neoadjuvant immunotherapy in their eyes now. And there's just all sorts of mapping that, changes for everything. And a really hard feeling is, could I have done something differently? Should I have done something differently? How does this affect my chances? And the podcast that we're talking about refers to fear driving decision-making in patients. And, especially if you're a new patient, you get ushered through some of these doors, but then when there are, choices you have to make, I think being uninformed leads you to choose what seems like the safest option, or just choosing the first one that's presented to you. Have you, in your 16 years now as a patient, how has your decision-making changed based on, your knowledge increasing?
When I look back kind of at the decisions I made, I can't really say I made decisions. Like I said, I just did what my doctors told me to do. But I'm really passionate now about people understanding their diagnosis and even shared decision making about how can, what's important to you, and walking through those steps, because it's different for everybody. And I am really excited that we're doing more personalized medicine now, based on people's needs. So that's been really inspiring. What I will say is where I am living now and working is a very rural area. So it's really a challenge. And again, just the earlier podcast was great because having a fear of what if I can't get treatment, and knowing there's places out there who will help patients is so important. But at the time I was living in Sacramento, and the access to services was really seamless. I mean, from the time I got in for the mammogram to the time I started chemotherapy, it wasn't more than 2 weeks. Whereas I'll see people where I'm at now waiting 6 to 8 weeks to start chemotherapy. So that's partially what motivates me to do the work I do, is to help people navigate these situations to get them in sooner, even if it means going out of the area, that sort of thing. But I feel very fortunate that I was where I was at the time to be able to have such smooth transition in care.
Yeah, I completely agree with the sentiment that the availability of good care is something that will save so many lives without a patient knowing it. Because I live in San Luis Obispo, which is a small town in between, LA and San Francisco. And I was lucky enough to get into UCLA's umbrella, and they have an oncology office in San Luis Obispo. If they hadn't, I think the specialists here otherwise are not particularly great, and I would have had to wait a while. And also, as I've talked to more and more patients over the years, I see a lot of people turning to, Google and or forums and or YouTube, and doing, everyone's choice in how they go about treating cancer is different. Everyone's diagnosis is different. But with the prevalence of social media and somewhat not science-based treatments being pushed, there's a lot of patients who end up turning to that because their access to care isn't fantastic, and they say, well, this is the option I'm going to go with because it sounds good enough, and the care here isn't great. And I think about that a lot because I could be any number of those patients if I was just in a different location. And it's kind of heartbreaking when you see people saying, well, I can't get in. I can't be seen. And it's like, well, this can't be the landscape we have for patients.
Right. Yeah, exactly.
So how long have you been in the advocacy space now?
Well, let's see. I started in this position in 2010, the fall of 2010. So, well, I guess that's 15 years.
Yeah, that is a good chunk of time. I'm just getting started in my career there. And one thing that I think is not understated, because I don't think there's a large focus on like, what are the benefits of being a cancer patient advocate? You almost have to get into here with some sort of experience, whether it's personal or familial or just, cancer having affected you in some way. I have yet to talk to someone who has gotten in here just like, hey, I just love helping cancer patients with no experience in the field.
Yeah.
But for me, it started as something that was like cathartic when I started to talk to other patients and realize that my experience could at least lend them somewhat of a framework to apply to their own unique case. I realized that this is just a self-perpetuating thing. The more, or a communal perpetuating thing, the more we all share our experiences and do good to help other cancer patients, the better this, I guess, field and or community is. Tell me a little bit about how that's affected you personally.
Yeah, that's a great question, and it's so true. When you've experienced something yourself, I just, there's even Dr. Susan Love has written what we call our breast cancer Bible. It's our go-to book about all things breast health related. And at some point she ended up with a cancer, and in her, later editions of that book, she wrote about what a difference it was being on the other side of the table. She's a surgeon. And what a difference it was after she had her own cancer diagnosis in relating to her patients. So I think that does make a big difference. One thing I really appreciate is that, I mentioned my little girl was 5 years old at the time, and just all of the fears around that. And she was starting kindergarten, and I really wanted to be involved with her first year in school. And, I even volunteered in her classroom, which was probably a bit risky when they talk about germy children. But I washed my hands obsessively and was fine, and was really lucky not to have any problems. But the other thing that I really learned from that is how important it is for little people in our lives to feel like they can help take care of us too, and giving them like jobs, roles. So, I would tell her, if you can bring mommy some water, that really makes me feel better. I'm thirsty. Or, help get some tea for me. Or even if you can just lay here and we can watch this movie together, it makes me feel better. I'm going to get better if you can, you help me. This is the ways you can help me. Even though they're little, they need to have what they can do on their end. So that's something I really try to share with my clients who have young children, what ways they can talk to their children and not scare them, and help empower them to be involved in your care team.
That's actually a really unique and unbelievable perspective. I haven't heard that too much from anyone that I've spoken to in terms of incorporating, people who are, especially children, who are kind of not in the know about the situation to make them feel better. Because that happens all the time with adults, like romantic partners or friends or whatever, people who are willing to help, but the cancer is a scary topic, or historically it has been, it's been taboo, and it was much more fatal. So I know that even when I was talking with relatives or my friends, they would just say, hey, how you doing? Is there anything I can do? But it would be kind of empty. And proactively getting someone who you care about to understand the situation and feel like they are doing something, I think that's really cool. So thank you for sharing that.
Yeah, absolutely. One of the jokes I have sometimes with I facilitate a support group for our young women. And one of the jokes we talk about sometimes is, people who are feeling uncomfortable, and I get it. Everybody's means, is doing their best, but it's how are you? Are you okay? Like they're scared to really say the cancer word. It's just funny how it is. But so, I think giving people from all ages what they can do, whether it's you really love to cook, and here's, the Cancer Fighting Kitchen is a cookbook where you can make some really healthy meals. And I would love it if you could make those for me, or, come clean my house, or whatever it is. People want to help. They just don't know how to or what you need. So assigning things that would be helpful is a really nice thing to do for them. It's a gift, I think, for our caregivers.
I think it really is, because a lot of the mental burden that we feel is passed on in different ways to them, but they have less insight to what's actually going on. It's, we're being thrown all of the life vests for this not sinking ship, but one that feels like it. And,
Right.
extending the life vest to them is pretty cool. So again, I think that's a beautiful notion.
So that's what I find empowering about my position working here, is being able to help share some of those things when people are newly coming into it, and how they can garner support from their loved ones by actually telling them this is what I need, and really encouraging, open communication with your partners about how you're feeling, and what, it's hard for partners too. It's a scary thing for them as well. So I think it's all a really important part of your overall care.
And, even conversations like these are a great forum, because now for whoever listens to this podcast, they're going to get your shared experience and your take on what it is to be a cancer patient. And, I just want to thank you for doing that. We're wrapping up here, but this has been a really great, set of answers that you've given. I really appreciate your perspective.
Oh, thank you so much. I'm so excited you guys are doing this. It's such a wonderful project, and yeah, it's really inspired. It's funny and it sounds kind of cheesy, but the diagnosis has really inspired my life and career. There's gifts sometimes in some of the horrible things that happen to us, the things that seem like the worst case scenario. And in the end, you're like, but I wouldn't have this now if that hadn't happened. So
I 100% agree. So, Brenda, thanks again. And, I'm looking forward to hearing more from you.
Great. I look forward to it too, Mike. Thank you.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The opinions of the speakers are their own and do not represent the opinions of organizations they're affiliated with, nor do they reflect the opinions of Manta Cares Inc. or Manta Cares' sponsors. This episode was supported by an award from the Patient-Centered Outcomes Research Institute.